Hi, Dr. Yass here. And what I'd like to discuss at this time is giving people an understanding as to what the MRI result represents. And for most people, their perception is that when a herniated disc, arthritis, stenosis, a meniscal tear, or rotator cuff tear is identified, the attempt is to assert that since it's found for the first time at the time of the pain, that in fact it is the cause of the pain. I need everyone to understand that this is completely false. This is a baseless statement. What you're actually seeing in the structural abnormalities are the resultant of the same cause of your pain, which is muscle weakness and or imbalance. So that is the big picture premise that I need you to understand. What is being found is not the cause of your symptoms, which is why for 40 years these structural abnormalities have been treated, and generally nobody's getting any better, right? We still have 140 million Americans, a billion people worldwide suffering from chronic pain. You've gone through an opioid epidemic. You've got basically the planet stuck on pain management, which by definition represents the fact that the attempt to identify the tissue in distress eliciting the pain, or in fact the cause, is no longer even attempting to be identified. That is because they can't, because diagnostic testing fails. So I want to just get you to understand some of these principles. So let's take, for instance, osteoarthritis, one of the most commonly diagnosed causes of pain in peripheral joints. Now, here's what you have to understand. How does osteoarthritis develop? It's not inflammatory, so let's end that. We don't have to get very far into that. Just understand that it is a mechanical wearing down of joint surfaces. So here's how it works. Let's say we're looking at your knee. We have your thigh bone sitting on your lower leg bone. And the premise of the knee joint is that there are two joint surfaces that approximate one another, and they are separated by, in this case, a meniscus, but generally throughout, it's either a meniscus or a labrum. And the whole purpose of that is to maintain a joint space. The purpose of the joint space is to allow those joint surfaces to move appropriately to allow for range of motion to be developed by the individual. Now, the general principle of how joints are designed is that you expect that 100% of one joint surface should be congruent to the other joint surface. So 100% of the joint surfaces are touching, and therefore 100% of the force running through the joint is absorbed through 100% of the joint surface. That is how the joint was designed. And if that happens, the joint is happy and functions perfectly. But let's say weakness or imbalance develops of the muscles surrounding and attached at that joint. If that happens, then you get a misalignment of the joint surfaces. And now the joint surfaces are only congruent in maybe 70 or 80% of the surface area. So we have 100% of the forces running through the joint are now being absorbed by 70 or 80% of the surface area. Well, that's a bad equation, and that's going to lead to a wearing down of what is known as hyaline cartilage, which is the white cartilage that sits at the end of the bones. And when that wears down, eventually you have exposed bone. And once exposed bone is developed, you either have hypertrophic bone growth, increased bone growth, which is something like a bone spur or a bunion, or deterioration of bone, which is like what you see when you lose the perfect surface of, say, the head of the thigh bone, or the head of the leg, the femur, the thigh bone in the knee. So when you're seeing that osteoarthritic condition developing, it's not eliciting pain. It's taking years to develop. And the development of osteoarthritis is actually the representation of weakness or imbalance of muscle at the joint, which has led to the loss of 100% congruency of the joint surfaces. So what you need to understand is that osteoarthritis can be controlled and is the result of weakness or imbalance of musculature. So the pain that's being experienced at the joint is from weakness or imbalance. And guess what? That MRI finding of osteoarthritis, or that X-ray finding of osteoarthritis, is actually a representation of weakness or imbalance of the muscle that attaches and surrounds the joint. We could say the same thing for a meniscal tear or a labral tear. These are just cartilaginous projections of one side of the joint. And the whole idea of that cartilage is to try to create a greater depth to the joint so that it can absorb force greater. Well, the same thing happens if you have 100% congruency of the joint surfaces. Well, then the health of that outer ring of cartilage or labrum is intact and it's all wonderful and there's no problems. But if you develop weakness or imbalance of the muscle that surrounds to the joint, you're going to lose congruency. And the joint surfaces are going to rub inappropriately, and they could actually grab that outer cartilaginous border, and they could slowly pull on it. And what you see in most cases when you talk about a labral tear or meniscal tear is not an acute tear, but a degenerative tear. It's happening over years, decades. And again, what is the cause of that labral or meniscal tear? Weakness and or imbalance of muscle. So again, this is another case where the MRI finding is not finding the cause of your pain. It is, in a sense, finding a secondary symptom, a resultant of weakness or imbalance of musculature. If we look at the spine and you look at herniated discs and stenosis and all this other nonsense, it's the same finding. If we generally take the lumbar spine region, so there's supposed to be this nice little curve there. And through that little curve, force runs through the lower back and then transmits down to the floor. That's how you support yourself. Well, if we look at the alignment of the vertebrae and the discs, when you have that perfectly subtle curve, then 100% of your body weight is transmitting through 100% of the vertebrae and the disc. But if you end up with weakness or imbalance, typically of the hip flexors and quads versus the hamstrings and gluteus maximus, then you're going to find out that you're going to end up having shortening of the hip flexors and quads, which is going to cause an excessive arching of the lower back. And so as a result, you no longer have a subtle curve, you have an extreme curve. And what does that do? It prevents the force of gravity running through 100% of the vertebrae and the disc, and now it's concentrated in the back of that area. And as a result, the disc material itself is going to have more pressure on the back of it versus throughout the entire area of it. And that's when you start to get that pressure that leads to a herniation or a bulging of the disc or any of the other structural abnormalities that develop there. So again, if we're looking at the spine and we're seeing variations to structure, these are not the cause of symptoms. These are representations of resultants. Not causes, but resultants of weakness and or imbalance, which is also the cause of your pain. So please understand, MRI results, although correct, you do have these structural abnormalities, they are not the cause of your pain strictly because they are found at the time of your pain. They are the resultant of the very same thing that is causing your pain, which is muscle weakness and or imbalance. The Yass method has proven this over 30 years, thousands of cases. People with these structural abnormalities who come in for treatment are then evaluated through the Yass method interpretation of the presentation of symptoms, and it's shown that there are muscular causes, and those muscular causes not only are causing pain, but these structural abnormalities, which is why we ignore those MRI findings and address what the symptoms represent, which is weakness or imbalance. We then go on, do the appropriate strengthening. The person becomes pain-free and fully functional. And even after that, if an MRI was taken, there's no question that those structural abnormalities exist, but they're not creating symptoms. Therefore, they required no treatment. They are independent variables. So I would strongly suggest, if you're out there and you get a chance to see this video and you've tried the existing system and you've been diagnosed by X-ray or MRI, start to understand that those findings are not causes. Those are not causes of your symptoms. They are actually presentations of resultants of the very same cause of your symptoms, which is muscle weakness or imbalance. If this video is helpful to you, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and hit the bell icon to get notifications when new videos are added or when I'm live on YouTube. If you'd like to contact me, maybe this has stirred some interest in you and you want to contact me by email, you could do so at drmitch@mitchellyass.com. If you've gone to the point of recognizing that this is the only true path to getting a proper diagnosis and treatment and you'd like to schedule a Yass method treatment session, you can go to my website, Live Without Pains, that's plural, livewithoutpains.com, /sessions, and that will bring you to the Calendly scheduler page. You can choose either an in-person session in Jacksonville, Florida, or you can pick a Zoom session. Just complete the information requested, including the day and time that works best for you, and you'll be set. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.